Hi, my name is Julia Heim. I'm a dietetic intern at Texas Medical Center, and today I'm going to be presenting a clinical case study on patient LC. So to give a bit of background about this case, LC is a 32-year-old female. Her height is 175 centimeters. Her weight is 53.6 kilograms. Her BMI is 17.4, and her usual body weight is 61 kilograms. Her primary diagnoses include hantavirus pulmonary syndrome, small bowel obstruction, and ascariasis, and then her secondary diagnosis is profound protein-calorie malnutrition. So upon admission, LC has a 3-month history of abdominal distension, poor appetite, a 16-pound weight loss, nausea, epigastric pain, and vomiting. And then in the days leading up to her admission, she has recently developed headaches, a cough, diarrhea, fever, night sweats, rash on the legs, and general malaise. So as far as the anatomy involved in this case, we're going to mainly be looking at her small intestine, which include the ileum, the duodenum, and the jejunum. So previously, she has already gotten an ileal resection, which has shrunken a lot of her ileum. And then, as we're going to see later in this case, she gets surgery on her duodenum and jejunum, which her entire duodenum are removed and much of her jejunum are removed, which are going to have some nutritional implications, which I'll be discussing later on in the case. So as far as some of her diagnoses go, we're first going to be discussing hantavirus pulmonary syndrome, which is a severe respiratory illness caused by infection with hantaviruses. It is spread by inhaling air that's contaminated by rodent urine and droppings. Symptoms include fever, chills, headache, and dizziness. Her next diagnosis is valley fever, which is an infection caused by the fungus coccidioids. It is known for living in the soil of Mexico, which is where LC does much of her work, and it is contracted by breathing in the microscopic fungal spores from the air. Symptoms for this include fever, cough, headache, night sweats, and rashes on extremities. Her next diagnosis is small bowel obstruction, which is a blockage in the small intestine, and causes include hernias, adhesions, inflammatory disease, and malignant tumors. Symptoms for small bowel obstruction include abdominal cramps and pain, bloating, nausea, loss of appetite, malaise, and constipation. Her next diagnosis is ascariasis, which is a parasitic roundworm infection. It is when worms mature into adult worms in your small intestine where they stay until they die, and symptoms for this include abdominal pain, nausea and vomiting, fatigue, diarrhea, and weight loss or malnutrition. And then her secondary diagnosis is profound protein-calorie malnutrition, and this occurs from inadequate nutrient intake. Causes for this include gastrointestinal disorders, unmet metabolic demands, and the inability to properly eliminate waste. And then the symptoms for profound protein-calorie malnutrition include irritability, weakness, weight loss, and amenorrhea. So to go through her hospital course, when she was first admitted, she is diagnosed with hypotension and edema, and then a mechanical ventilator is ordered for her. As far as nutrition goes, the registered dietitian orders TPN at first, and then an abdominal x-ray shows curvilinear soft tissue density cords, gaseous dilation of the stomach, and multiple loops of small bowel. Her abdominal ultrasound shows dilated loops of non-peristaltic small bowel, and then her CT scan shows tube-like structures through the small bowel, a small mass in her jejunum, and ileum wall thickening, which is indicative of small bowel obstruction. For her exploratory laparotomy, 100 centimeters of proximal jejunum was found to be necrotic, and then they discover Ascaris roundworms, as well as a bezoar mass in her duodenum, which is right here, and it looks like noodles. And then for the removal, the bezoar mass was milked to the necrotic jejunum, where 100 centimeters of the jejunum was removed, as well as the entire duodenum, which is 22 centimeters. And then she gets an end-to-end anastomosis. For her MCP assessment and her food nutrition related history, she is a strict vegan, and her chef prepares her meals every day. She exercises daily, and there is no reported tobacco or alcohol usage. For her anthropometrics, she's 175 centimeters tall. She weighs 53.6 kilograms. Her BMI is 17.4, and her usual body weight is 61 kilograms. Her relevant medical history includes that she is vitamin D and B12 deficient, probably from her veganism. She has hypothyroidism. She has type 1 diabetes. She has Crohn's disease. She has gotten a previous ileal resection from her Crohn's disease. And then she has possible rheumatoid arthritis on her mother's side. And then on her father's side, there is no known medical history. And then some of her concerning lab values include an elevated BUN of 31 milligrams, which indicates possible kidney disease. She has an elevated creatinine level of 1.53 milligrams, which indicates possible kidney disease. And then low creatinine clearance of 55 milliliters, which also indicates possible kidney disease, as well as elevated white blood cell count at 17.3 thousand units, which shows that her body is fighting off infection. Low albumin of 1.8 grams, which shows that she is lacking protein. And then her high C-reactive protein is 1.8 milligrams, which also shows that her body is fighting off infection. As far as her medications that are prescribed during her hospitalization include ivermectin for her roundworms, omeprazole for her heartburn, loperamide for diarrhea, cholestyramine for small bowel obstruction, magnesium oxide for constipation, as well as epigastric pain, and then famotidine for her GERD and acid reflux. So her NCP diagnosis is inadequate protein and calorie intake as related to small bowel obstruction, a vegan diet, ileal resection, hyperthyroidism, and ascariasis, as evidenced by a 16-pound weight loss over 3 months, her BMI of 17.4, and her low albumin of 1.8 grams. So in response to this, the dietitian orders osmolate at 1.5 at 45 milliliters an hour over the course of 24 hours, which equals 1620 kilocalories, 68 grams of protein, and 825 milliliters of free water. And then she orders 33 milliliters of water over the course of 24 hours. She wants to honor Elsie's vegan diet, but encourage her to increase her protein. And then she guides Elsie to supplement with 50,000 units of vitamin D weekly over the course of 8 weeks. So in conclusion, this is a 32-year-old female with a 3-month history of gastrointestinal discomfort and weight loss, with recent symptoms including headaches, cough, and fever. Her primary diagnoses include hantavirus pulmonary syndrome, small bowel obstruction, and ascariasis. Her secondary diagnoses include profound protein calorie malnutrition. And then the patient was found to have a necrotic jejunum and parasitic bezoar mass, and a removal of the necrotic jejunum and entire duodenum and bezoar mass were performed. She has suspected kidney damage. She is ordered enteral feeding from the dietitian. She is discharged after 1 month of hospitalization, and then she was scheduled for a bowel transplant in a month. Thank you so much for listening, and have a great rest of your day.